In its simplest form, hyperbaric therapy or hyperbaric oxygen therapy is breathing oxygen at a higher pressure than atmosphere.
Dr. Paul Kloss is the medical director for Mayo Clinic's Hyperbaric and Altitude Medicine program.
Oxygen therapy has been in medical therapy both in the United States and around the world for several decades now.
We benefit from a triple lock hyperbaric chamber. It's rectangular in design. It is 10 feet wide and 14 feet long.
Mayo Clinic actually has 2 such treatment rooms within its chamber. Many of the estimated 1,400 treatment facilities in the U.S. use only monoplace chambers, which are designed for a single patient. Mayo uses these too, but for specific cases. Fewer than 200 facilities offer multi-place chambers, and Mayo Clinic is one of just a few dozen of them, equipped and staffed to perform critical care.
So we have a unique chamber in that we're at the ability to pressurize 12 patients at once.
Pressurize 2 to 3 times the atmosphere at sea level.
Your ears do pop, yes.
The sensation is similar to descending in an airplane, although the passengers here are all outfitted with special headgear.
And this is basically a clear plastic hood that's applied. It's an oxygen tent for all intents and purposes, and that delivers 100% oxygen for the duration of their therapy.
And why breathe the oxygen under pressure?
There are laws of physics, and when you increase the pressure, you dissolve more molecules of oxygen in a fluid state. It triggers the body's response to produce new structure, new blood vessels, new connective tissue, and to promote healing.
After her treatment, it continued to fill in and heal.
That seems to be exactly what happened for 6-year-old Skylar. Multiple surgeries had repaired her cleft palate, but a small fistula or hole opened up on the roof of her mouth, where the resulting scar tissue had reduced the blood supply. Dr. Sheila Kofer scheduled another surgery to close it. But because healing could be a challenge, she also turned to Dr. Kloss's team to find a hyperbaric solution.
People thinking outside the box and really using kind of an innovative approach to treating a difficult problem.
It healed me really well and quickly, and I was very, very pleased with it.
Dave Boyette was battling chronic diabetes-related wounds. He'd already lost a big toe and was headed back to surgery to try to stop the spread of a dangerous infection.
He was at risk of having to need a revision of that amputation and lose the lower part of his leg.
Dave and his doctors are convinced that dozens of preoperative dives in the therapy chamber are responsible for what he found instead when he woke from surgery.
I looked down there and it was all bandaged up. My foot was still attached and it was huge. And yeah, I started to cry right there. I was so thankful that I still had a foot.
Dr. Kloss says, logically, the improved blood vessel growth within damaged tissues also carries more of a vital immune-boosting component.
It helps the white blood cells work more efficiently in those areas that are without adequate circulation, and so it helps fight infection.
Because of the high concentration of oxygen, no handheld electronics are allowed in the chambers. The system is carefully monitored and equipped with multiple fire suppression systems. Additionally, a staff member is always present inside with patients.
Patient safety is paramount to what we do every day.
Dr. Kloss says being able to intervene in potentially deadly and disfiguring conditions when few other options may be effective has made his experiences with hyperbaric oxygen therapy the highlight of his career.
We have the respect of our patients and referring physicians. Many of the things that we do have more evidence than most medical practices, including surgery.
For the Mayo Clinic News Network, I'm Dennis Doda.